place, we are now going to irrigate the tube. So this checkoff will go along with insertion. The two skills kind of go together. A lot of times when you put a tube down and you've confirmed placement, you'll irrigate it before use. So a lot of times these two will go together. So what I need for this procedure will be a pair of non-sterile gloves, my stethoscope to confirm my placement. You may also want to give your patient some communication method, like a piece of paper and a pen, just in case they need to tell you something while you're doing this. You'll also need a syringe, preferably a Toomey syringe. You may see some facilities that they have bulb syringes, but these seem to work best. And you'll also need a towel. You'll need some normal saline, which will be your irrigation solution that you will use. Now this is not a sterile procedure. Think of this tube, it is going into the stomach, and what you put in your stomach is not sterile. So this person's, the irrigation solution doesn't have to be sterile either. And you'll also need a container to put your solution in so you can draw it up. So the first thing I'm going to do is I'm going to check and confirm my order. The physician will write to irrigate as needed, the NG tube. They may want it irrigated so many hours. It just depends on the physician and what they want. So you'll check that. You'll compare your Cardex before you go get your equipment together and go into the patient's room. So I've checked my order. I've got all my supplies together. I'm going to go in and talk to Miss Long. I'm going to knock on her door. Hello, Miss Long. I'm going to irrigate your NG tube, the tube that's in your nose. We want to make sure this tube doesn't get clogged. We want to prevent that so we don't have to replace it. Ask her if she has any questions. If not, you can go ahead with the procedure. So the first thing, I'm going to go ahead and get her in a little bit better position to irrigate this tube. I'm going to put her in a semi-Fowler's position this time. Now when you put the tube down, you want her in high Fowler's, but for irrigation purposes, a good semi-Fowler's will be best. Once again, I don't have to raise all my rails because I'm not raising the entire bed, just the head of her bed. Help her sit up just a little bit more. There we go. Go ahead and put the towel across her chest. Go ahead and give her her pen and paper in case she needs to talk to me. Go ahead and pour my saline that I need. We'll need about 30 cc's to irrigate with, or 30 mLs. Now when you pour, you always want to cover the label with your palm so not to mess up the label. You also may need more because you're going to irrigate until the tube is patent and clear. That's the purpose of irrigation. So you may need more than 30 cc's. So I'm going to pour it into my container here. I'm going to go ahead and put on my gloves. And if the patient is hooked to suction, you want to disconnect suction and just clamp the tube, which is how this tube is. Now, I'm going to listen. The first thing I'm going to do is I'm going to listen for bowel sounds. So I'm going to have to completely uncover my patient's abdomen. Never ever put the stethoscope over linens or their gown. And I'm going to listen in all 4 quadrants. And I hear bowel sounds, active bowel sounds. So the next thing I want to do is I'm going to take my syringe and I'm going to check for placement of this tube before I ever put anything down a tube. Always, always check placement. These tubes can migrate. A lot of times they'll migrate back into the trachea. They can go to the lungs. So you want to make sure they're in the right spot. They can even migrate back up where they're in the mouth. And if the patient's having trouble swallowing and you're putting fluid down it without checking it, that patient could get choked. So always check your placement. So I'm going to draw about 15 to 20 cc's of air. clamp my tube. Connect it. Now I'm going to place my stethoscope over the stomach. Now I'm going to push this air in quickly, and I will hear a swishing sound, or some people call it a bubbling or a gurgling, in the stomach. It'll be very obvious when you hear it, and that way I know it's in the stomach. Now the next part of checking for placement is I want to aspirate stomach contents. So I'm going to pull back on my plunger, and I should see gastric contents coming back into this syringe. So I can put those back in. If the patient's just on suction, a lot of times you will not have a lot of gastric secretions. Now, when we're checking placement for a patient who's getting feeding, they may have a lot of secretions. And usually the cardinal rule is if it's over 100 mLs or cc's of secretions, you'll discard it. And if it's less than 100, you'll just reinstill those secretions. So it depends on your facility policy. Always know that policy and go by it. So next I'm going to draw up my normal saline, and I'm going to draw up 30 cc's. So I've got my 30, and I'm going to clamp my tube and connect it. And you'll want to instill this slowly. The purpose of this is to make sure this tube is clear, that all these secretions that are being suctioned out are not gathering and clumping up and clogging up the tube. So when you push it slowly, you'll push them back down the tube where they need to be. So slowly. If you meet a lot of resistance, do not ever force. You could cause some problems. You could also cause the tube to back up and you'll spray yourself in the face. So don't ever force it. So once I've inserted that, I'm going to go ahead and aspirate and pull back. You want to get at least the 30 that you instilled. So there's my 30. You can go ahead and pull back more. If you get more, let's say I get 50 mLs, I would count 20 as output. So the 30 that you put in doesn't count, but anything in excess counts as output. You're also going to continue doing this until it's clear, until the tube is clear, you've gotten everything, there's no clumps, no clogs in the tube. That's the whole point of irrigation. Once I've completed that, my tube is clear, I'm going to connect her back to suction like she was. Go ahead and take off my gloves, clean up my supplies. I'm going to wash my hands and record the procedure that I just completed. And I also want to document in the output record how much I got back.